Thank you so much. Thank you for having me today. I am so excited. This is a dream to hear about so many amazing initiatives, hospitals, community-based organizations working together to improve maternal health outcomes. And so I have been thrilled to listen to our speakers today, and just hear more about what's happening in other states. I am from Southwest Missouri, however, with the Doula Foundation. However, for my entire life, vacationed and visited in the beautiful state of Arkansas for my entire life, and going and visiting your beautiful camping sites and fishing sites and all of those wonderful things. I have a lot of family in Arkansas and Texas, and so we meet in Arkansas to get together because it's so beautiful there. So I just wanted to say that. Thank you for allowing us to come and visit in your state. So I will go ahead and get started and tell you a little bit about our history. You'll see, I think, why I'm so excited to hear about our other speakers today, because this has been a long-standing history with the Doula Foundation. Again, we are a nonprofit 501c3. And we honestly, a part of our history is on the next slide that we started actually 24 years ago. Our founder was a nurse, and she was teaching childbirth education in our local hospital. And as she was teaching in our local hospital, she started noticing there were so many moms, single moms, moms with previous birth trauma, or domestic violence, sexual abuse, so many different challenges these moms were facing. And as she was teaching, her and our co-founder were like, what more can we do to support these moms that are going through and facing so many challenges, not only during pregnancy, but who's going to be with this mom at the birth and support her there? And then what happens when she comes home, when these moms come home with their baby? What happens? Do they have support? Do they have the tools that they need to really succeed in that early parenthood time period? So that's why they had the passion and excitement to learn about different abilities, different opportunities that they could help these families. And so that's when they researched, they learned about doula work. As you can imagine, in Southwest Missouri, no one even knew what that term meant. It was a very confusing time during that time. And for 24 years, we've been standing on top of a mountaintop with a megaphone, trying to share our story and the impact and the amazing opportunities that we have to support moms and families during that pregnancy, the actual continuous labor support, and then also that early parenthood, that especially that first 12 months postpartum, to really create change and make an impact and improve maternal and child health outcomes in Missouri. And so that was what got us started at the Doula Foundation. Again, we have always been a community-based nonprofit program. I know that we were the first community-based nonprofit doula program in Missouri. We've been told it was the first one originated in the US, but again, so many grassroots organizations getting started. So we do not want to for sure, claim that, because I know so many grassroots groups were coming together around those times because of so many programs like DONA and a Health Connect one, and all of those groups that were coming together throughout the nation. And over the past 24 years, and I'll go over this just a little bit more detail, but more than 340,000 hours of support and education have been provided, and over 35,000 individuals have received comprehensive services. And these are free services to these families that are low income and Medicaid. And over 500,000 essential baby and maternity items have been distributed through our baby and maternity boutique that we have at our nonprofit too. So I'll go into a little bit more about primarily the families that we serve on the next slide. And so we, again, nonprofit organization, community-based program. A lot of people didn't understand specifically community-based doula programs back 24 years ago. But in Southwest Missouri, we had a lot of needs. We are primarily a rural community. We're the third largest city in Missouri. However, we have families that are driving 2 hours to get to a hospital that delivers babies, and to get to access the healthcare that they need. So we primarily serve low-income Medicaid moms, single moms, lack of family support, a diverse population. We have a lot of refugees that move into this region. 75% of our moms report a mental health concern or diagnosis even prior to pregnancy. They have a history of trauma, domestic violence, substance use disorders. They have those social determinants of health, housing, and food insecurities, and they are at risk for entering into the foster care system. And I know that many communities are dealing with our foster care system being overrun and overwhelmed. And so we do have a lack of resources in that as well. In our community, a lot of people don't realize this, but in Southwest Missouri, we are addressing many community red flags. And of those red flags in the state of Missouri, on the next slide, it shows that we have the highest rate of child abuse and neglect in Missouri. We have the highest reported cases of domestic violence, substance use disorders, and highest percentage of individuals in households living in poverty. A lot of concerns and challenges in our region. And there's not a lot of funding resources that come to our community. Historically, especially, and I've talked to many people, and I've actually been writing grants. I know Lindy talked about writing grants. I've been writing grants for maternal health nonprofit organizations in Southwest Missouri for 27 years now. Historically, the funding does not come to our region. It stays in our larger cities, St. Louis and Kansas City. And so we have a lack of resources to work towards these challenges that we face. And it has created, unfortunately, more challenges in our area. We have a limited access to affordable mental health care for our low-income and Medicaid families, affordable housing. For many years, people talked about the low cost of living here and in Southwest Missouri, so people would move here for the low cost of living. However, our wages have not reflected a livable wage in this region. And so now, because of that, housing, childcare, the rising cost of all of those living expenses is actually very disproportionate now to our wages in this region. We have a childcare crisis, especially childcare that is subsidized for Medicaid and low-income families. And in Missouri, we had the report that came out, the Pregnancy Associated Mortality Review report that came out that said Missouri is rated number 44th of 50 states in maternal care and pregnancy associated deaths. And that if you're a woman on Medicaid in the state of Missouri, you're 8 times more likely to die within that 1 year from a pregnancy-associated death, which we know to be a lot of those social determinants of health that are challenging them that they are facing. So at the Doula Foundation, I know we talked a lot today, and I loved the presentation on the differences between doulas and their training and professionalism. And so I would love to speak to that because it is so true. It is varied throughout the state and throughout the United States. The level of professionalism and training that is provided or that doulas are required. And so many years ago, we set aside and we worked with medical professionals at our hospitals and our medical teams and our health department and our Greene County WIC departments and nurses and doctors, and we came together with them many years ago and we said, hey, we want professionalism. We want the appropriate training to make sure that when you see us come in the door, when you see doulas with our name tag on, with our uniforms, we want you to know that those doulas have gone through a rigorous professional training and certification process. And so all of our doulas are certified birth and postpartum doulas. We go through organizations. Actually, our founder actually trained under Penny Simkin with Doula. And so for many years, all of our trainers have been from national evidence-based training organizations. And we now have this all under one roof. But our trainers and facilitators have 30 years of experience in training and certifying birth and postpartum doulas. Many people don't realize this, but that can be a 2-year process just to get certified through those programs. Some are able to get through a little quicker because they have certifying births that they have to attend. And like Lindy was talking about, get those professional recommendations from medical teams, from parents, and other professionals in the community. We have a Doula Foundation internship program called the Doula Foundation Academy. And so through that program, while you are receiving your certification as a birth or postpartum doula, then we will mentor you. We have veteran doulas that will mentor you through that process. And we have a credentialing coordinator now that helps you through those modules of training. So it can be, there's so much reading that's involved and writing assignments, the birthing process, the workshops, the online video training modules. And so there's a lot to this process. And so we tell everyone before they enter into our internship program that this could be similar to the length of an associate's degree. And again, it all depends on how quickly they can go through the modules, if they have a full-time job, those kinds of things while they're training. We are also certified perinatal community health workers. We are credentialed with the state of Missouri as a credentialing provider to certify perinatal community health workers as well, for home visiting purposes, for learning about how to connect families with community resources. As a community-based doula, we've been doing that for years. The community health worker profession gave us that opportunity to add another certification so that others would understand what we're doing in that process and how those two professions collide in our area and collaborate. We have certified childbirth educators on staff, peer breastfeeding counselors. We have IBCLCs as well that work and are facilitators with us. We have certified prenatal and postpartum yoga instruction. And the reason we did that was one of our co-founders was an expert in toxic stress on the body and how that can relate to complications in pregnancy and in childbirth and postpartum period. And so we've incorporated that into our program and services and classes that we provide at the foundation. We can skip the next slide because it looks like with some of the other presentations, we've already covered the difference between private practice doulas, community-based doulas, and then as we combine community-based doulas and perinatal community health workers to our profession and certification. So our dream would be that more doulas would come alongside and we could maybe work together to have more standardized practices, more standardized trainings and credentialing programs throughout the state as well, so that our hospitals and our medical teams could feel more confident in working alongside our professional doulas. And something about, I would love to visit with the Baptist Women's Hospital too on the badge program, because that is something we've been looking at other states and programs that they have for that badge program, again, just to create collaboration. We've been doing that from a grassroots effort with our hospitals and doing tours with our hospitals and collaborating on trainings and those kinds of things throughout the years. But to have a wonderful badge program that is actually uniform and standardized, so that each group understands the importance of that and that professionalism, we would love to incorporate something like that in our program as well. On the next slide, I talk about Our training program, again, I've talked about the academy and our accreditation. In all of those trainings, we add cultural competency trainings and congruence, mandated reporter training, HIPAA, bloodborne pathogens, ethics and professionalism training. So again, this is from the perspective of we have always worked in hospital births because that is where our Medicaid moms are giving birth. And so I know that's unique and it's not the standard for all doula practices, but as a nonprofit community-based doula program, that has been our number one focus, is to work with our moms in the hospitals to help create the best process that we can. And so our ethics and professionalism training is highly rooted in ethics and professionalism, working with our medical teams, working in the hospital setting, and making sure that we have that mutual respect for our medical teams and our doctors. We, again, as doulas, we know our scope and our standards of practice is that we are non-medical. And so we are not diagnosing or giving out medical advice. And so we are working together to promote better healthcare for our moms. We do home visitation training and safety programs because our doula, community-based doulas are providing that home visitation with trauma-informed care, diversity, equity, inclusion training, maternal mental health certification. All of our doulas go through maternal health first aid certification. We provide nonviolent communication education and training. And then, of course, CPR first aid training. And then we employ at the Doula Foundation full-time social workers and case managers as well to work together in similar to what you're talking about with the team birth approach. Because again, we're working with that population that that really has high challenges and those social determinants of health that are needing to be addressed. Next slide on, we talk about as far as a community-based doula and a PCHW, those things. And again, some of these things have been addressed, so I'm just going to skip through some of this, but just talking about the case management and the continuity of care, improved health outcomes, reducing healthcare costs, and reducing barriers to care, and doing those home visitations. So I would love to just give you an example. So we have a mom just recently that had a major medical condition in her pregnancy. She was needing to go and to the doctor's office 3 days a week for monitoring and at our local FQHC. And so she had no transportation. She was having to pay an Uber everywhere she went. She had a 2-year-old, and she was also told that her baby that she was pregnant with was likely not to survive outside of the womb due to her medical condition. And so all of these things, this is what she's hearing. We meet her, and she was referred to us by another agency that we work with and collaborate with. And so when we meet her, we do an assessment. Her original intake and health assessment and birth assessment was, everything was pretty fine. She presented very well and everything was going fine in her pregnancy. Then our doula was assigned. We started visiting her in her home. We started uncovering and layering down to all of the medical condition, the needs. She was not understanding 100% all about what was happening with her medical condition. All she knew was that she had a 2-year-old that she needed to feed. She didn't know if she could spend the money on an Uber to go to these appointments 3 days a week and miss work at the same time, and not have money to pay for the Uber and or food coming in. We went to her home. She had no food in the refrigerator or in the pantry. We noticed all of these things happening and we were like, okay, we need to address some of these basic needs before she can even hear about what's happening in her medical condition. And also she was having to choose between giving food to her 2-year-old or going to these other appointments. And this baby is likely not to survive is all she heard from those doctor's appointments. And so we were able to address the needs that she had. Of course, we immediately got food. and things like that for her. We immediately got transportation for her to get to every doctor's appointment and back and forth to work on those times that she needed to get to work. We helped her with some childcare needs that she had for the 2-year-old for while she was going to these monitoring appointments at the doctor's office. And so we, of course, reduced barriers to getting that care. And then, long story short, this mom now has a car. We got a car donated for her. We were able to get her to those doctor's appointments and be on call for her 24/7. And so now she delivered that baby at 39 plus 1 weeks. Healthy, happy baby boy. Little Dean is his name. And she has so much more confidence now as a mom that she made it through all of these challenges. And now she has 2 healthy children, and she also has a support system to get her through that. So we really advocate for home visitation and how important that is in our program to be able to identify a lot of those social determinants of health that sometimes are not revealed in a health assessment or a few visits. And so we've learned that we learned so much more by getting eyes on the housing and home situation. And so again, just connecting them with the proper community resources. We call it a warm lead because we have a pregnancy maternal mental health coalition that we lead. And so we are working together with these agencies on a daily basis. And we're, of course, with permission and HIPAA compliance, we are able to share with other case managers and other workers the challenges that these moms are facing. And we are now working with our managed care companies. We have 3 here in the state of Missouri. We're working with them and their care managers as well to make sure that they understand, hey, this mom that's with Home State Health or Healthy Blue or United, this mom, it has these challenges. Are there some resources that your care managers can provide as well? And so really collaborating. We don't want to reinvent the wheel. We don't want to duplicate services. We really want to really be that continuity of care and that spoke in the wheel to make sure this mom is getting all of the care that she needs and the support services as well. You guys are very familiar. I won't go over social determinants of health, but just being able to work within these family groups to really address all of those needs and identify them, because again, that can be challenging to identify those. At the Doula Foundation, on our next slide, we talk about our classes we provide. It's evidence-based childbirth education and support prenatal and postpartum yoga to reduce stress, cortisol levels. We actually wrote that curriculum. It's a 8-week curriculum that we wrote in collaboration with March of Dimes. And so we have their endorsement and collaboration on this curriculum. Parenting and lactation education, fatherhood education, or partner education, postpartum parenting support and stress reduction classes. And then we have an extended postpartum program. So if any of our moms, we're continuously doing health assessments and Edinburgh scores and those types of testing models and maternal bonding scores, so that we can refer our moms into other programs. We have an extended postpartum program that we can work with a mom up to 12 months postpartum. We also can collaborate with other home visiting programs to make sure the mom is enrolled into some of those programs that will stay with them for 3 to 5 years, thankfully through some state and federal funding through those programs. We do a lot of personal case management, in-home visits, and 24-hour on-call support surrounding the birth, breastfeeding, lactation support, newborn care, and again, just working in collaboration with our medical teams and also the social service organization teams to make sure this mom is completely supported and can be successful. So the next slide shows kind of that continuity of care that spoke on the wheel. Oh, I apologize, I skipped one. And Lindy and Gina, I believe, mentioned some of these things, but getting that early access to care because we're on call with them and we have built that relationship with these moms, that makes a huge difference. So sometimes they will share with us information that they have never shared with another person before. They feel confident, they feel supported, and they feel close to us as a family member, but a family member who has a lot of education and background and maybe support connections. And so we have found that it lowers the prenatal preterm deliveries, lower birth weights. It lowers, of course, the C-section rates. It lowers those stress levels and cortisol levels, fewer ER visits and emergent care visits, which actually reduces costs, of course, and reduces overrunning and overwhelming our ER rooms in our city. Increasing access to prenatal care. When they come to us, the very first question we ask them is, are you enrolled with a OBGYN? Do you have a medical care team? Have you been to a visit? And so we've been able to increase our at-risk population into getting enrolled into prenatal care, proper prenatal care at an earlier stage during pregnancy, which is very important. We work with statistics and data with our managed care teams. We did a doula pilot program with Healthy Blue in the past 2.5 years. We now have a contract with our managed care teams here in Missouri that we provide data for them so that they can prove the concept of how we're able to reduce costs and improve maternal health outcomes. Again, fewer surgical births, fewer neonatal admissions after birth, greater success in initiating breastfeeding and continuing breastfeeding. Again, this population is challenged with those particular things that we know will improve their maternal bonding and success in parenting. We are preventing child abuse and neglect by promoting that stronger maternal and fraternal bond as well, and giving them greater confidence in parenting by adding relationship education classes and parenting education classes as well, and staying with them. The next slide just shows just a little, we work very closely again with our hospitals, FQHC, managed care companies, and we are working with the state and the Missouri Hospital Association to actually provide maybe some doula policies for our hospitals to improve those maternal health outcomes and numbers. And so I do make many trips to our state capitol to just share stats and information with them of the improved outcomes that we were able to help with. And we work very closely with our Greene County Health Department, WIC departments, and those other social service organizations. And just a few stats, I'll just share with you some of our amazing news over the years. The next slide is just for the past year. So this is not 24 years of history, but just on an annual basis, we are able to provide almost 30,000 hours of consultations, prenatal case management, postpartum lactation, childbirth and parenting. We are able to provide over almost 20,000 baby and maternity essentials given to moms, diapers, wipes, clothing. And we have a lot of moms that we're the first call they make when they've left a domestic violence situation in the middle of the night and they're starting completely over and they say, what do I do? Where do I go? And we can help them through that and even get home furnishings. And then our next slide talks about the success. 97% of our at-risk population are delivering full-term deliveries, 91% initiating breastfeeding, 98% receiving appropriate prenatal care, and 100% receiving pregnancy and postpartum education and community resources. These numbers, of course, we are very proud of because, again, of the challenges that our population is facing on a daily basis. So we are so grateful that we have funding, grant funding. We just do individual fundraisers and grant funding through small family foundations. We've just been doing this for many, many years. And now our managed care companies are starting to come around with some possible funding for contracts until our state can pass, hopefully, a doula reimbursement program through Medicaid, which we are looking hopefully in the next year to get that passed through. So the next slide is just a picture. We do a reunion every year for our families because they do become a family to us. This is just one of our reunion picnics that we have. And we do a lot of single mom outreach programs and wonderful events that we do. But we are so grateful to be a part of the lives of these families and to work together professionally with our hospitals and medical teams as well to improve maternal health outcomes. So that is our story.